welcome to Barks to Basics with Jamie Diaz. I have Dr. Mann here from Boca Midtown Animal Hospital. Thank you again for joining.
My pleasure.
So this is something that I can probably guarantee most people have no idea about. So it is getting Fear Free Certified. And we're going to kind of go into what that means. But so I'm a Fear Free Certified trainer. So I am licensed trainer with Victoria Stillwell, and she had a conference, and Dr. Marty Becker was there, and he was introducing this Fear Free Veterinarian kind of thing, right? Of course, as being a force-free trainer, I was all into it. So for me, it's really about, and you can even go into more to this because I'm sure I'll forget things, making your dog's experience as best as it can, but really focusing on that fear aspect of the dog. So instead of so what we had learned too as a trainer, kind of teaching a dog to do things like for blood draws, for nail clips, for eye drops, all this stuff. So we learned as a certified trainer, I learned different things to, teach a dog a touch cue to stand there while a dog's getting the blood draw in the back. And obviously this takes time and stuff, but it's really about reducing the fear in that animal when they go. Because at the end of the day, we're like a team, right? Veterinarians are my biggest referral, and I would like to be in the same page with veterinarian offices too. The problem is they're not all even, everyone's not on the same playing field as far as veterinary practice. So when I saw that your whole facility, Boca Midtown Animal Hospital, was Fear Free Certified, there's a lot that goes into it. You can't just say I'm a Fear Free vet, right? There's a lot of vets that are Fear Free, but they don't have those certifications. So let's start from the beginning. I also think all veterinarians care about animals. That's why they get into this, but not all of them. I don't think as many go this fear-free route. So how did you first even hear about this, and why did you choose to go the route of getting your facility to be fear-free certified?
That's a great question. I was also exposed to the fear-free method at a conference, and it was many years ago. And it was actually at one of the Gulf conferences, which was actually here in Boca Raton at the Boca Raton Resort. And Dr. Becker was there, and he was talking about it. And I said, you know what? This makes so much sense. And my first recollection of what fear-free is, when I think back to my childhood, is I would go to the bank with my mom, and she would make a little deposit, and the banker, the teller, would always give something for the dog who was in the car, like a little treat. And I was like, wow, that's so smart. They're associating a car ride that might make a dog anxious to the bank with a positive reward. They're giving him their paycheck because they want to make sure that dog is happy when he comes to the car. They don't want him anxious and things like that. And they're doing something to associate something positive with something that might make a dog nervous, like taking a car ride. Dogs and cats, they do get nervous when they go to the car ride, whether it's to the vet or the bank or any of those places. So the more we can prep them before going into a car for a short trip, making it a good experience for them, even just going for a car ride and just giving them treats and then taking them home without going anywhere. Just do as much as you can so that your pet has a good experience at the vet, because you want them to be able to go there when they're sick, because they're going to be even more anxious. And you said fear. It's always fear, anxiety, and stress. Those are the three factors that we want to try to minimize.
So when you saw Dr. Becker, you already had your practice, I'm assuming?
Yes.
Right? Because you've had your practice for a long time. What does it entail? And, because it's little different things. It's like when your dog goes on the scale, putting a blanket down or something warm when they're getting examined, just making it more comfortable for them. What was it that you said, I'm going to do this for my whole facility? And what does that entail? Because am I correct that you can't just say, oh, we're fear-free now, right?
Right. You can become fear-free certified as an individual, just like you did for your training program, as an individual trainer or as an individual veterinarian. And your team members can also get fear-free certified. To have a fear-free certified practice like we do, I had to have all of our team members get the accreditation to get the certificate. It's an online program. Mm-hmm. You can do a course. But in veterinary school, When I went to veterinary school, it wasn't available, and we didn't learn body language of pets to look at stress. We didn't learn when their eyes are wide or when their ears are back or their face is not relaxed, it's pulled back, that those were signs of fear, anxiety, and stress, and we needed to respond to that. We didn't learn to prioritize what we did at the vet visit that was best for that pet. Maybe taking that temperature of that dog is something that triggers it, and that's not the priority for that pet at that time. Maybe they don't like their paws being touched, and we have everything documented before we even touch that dog. So we know, okay, these are the trigger points for that particular dog or cat. We need to be aware of what we're doing to try to minimize their reactions to the negative things they don't like.
So I've heard that you're not the first veterinarian that I've heard this from, but isn't it kind of crazy that in vet school they don't, I hope they changed it now.
It's changed. Now,
okay.
A very large % of veterinary programs have Fear Free certification in their program. And I'm actually very proud that I helped bring Fear Free to my vet school, which is Ross Vet.
Oh, that's amazing.
Yes, I'm an ambassador for their program. And to me, I said, listen, guys, this is something that should be part of your program. And if you didn't know, Ross University is the biggest veterinary school in the world based on the number of graduates. So they have continual enrollment. That's where I went. That's why I was just speaking at the West Indies Veterinary Conference. Mm-hmm. But it's so important to me to have these young, talented brains understand how important emotional well-being is for these pets. And that's why, I constantly put that out there, just like you do about being fear-free, making sure we're giving them rewards. These dogs and cats are doing things for us that they don't understand. And they need to understand, hey, I just did something that was good and I want a reward for it. And they need to associate it with something good. So it's so important because there's so much misinformation. And I'm so thankful that you and I were able to connect for that.
I mean, it was one of my, so if you're looking for a veterinarian, obviously everyone's not in Florida or in Boca, but one, if you're in South Florida, find a fear-free veterinarian like yourself, because I feel like they're still kind of rare. And I think it makes like such a difference when you're like dedicated to fear-free. So if you're looking for a vet, you can ask them. Everyone should know what this is right now, right? Are you fear-free certified? What are some of the things? So everyone takes the course. I wonder if I could do that for my trainers, because I'm a fear-free trainer. I wonder if they do facility. I'd have to email them and see, because I would love for every single one of my trainers to get fear-free certified. I've had trainers. There's also fear-free groomers, guys, which is like huge too, especially if you have a dog that has to be groomed. I've paid for some certifications like that for some of my groomers, some of the trainers, but I was just thinking, I was like, I wonder if I can get my whole facility done fear-free, but I'll look into that. What are some of the things? Now, listen, there's a lot of veterinarians that are amazing out there that are not fear-free certified. So I understand that. But what are some of the things that you would do? You posted a great video with the little girl with the little puppy, which was like such a wasn't it a strange mix? What was the mix?
Yes, it was a French bulldog mixed with a little Shih Tzu and something else. They had this other puppy that was a mixed breed visit for 4 days, and they happened to like each other enough to be able to make the magic happen.
Yes.
Yeah. So but the little girl with the puppy in the room, with the puppy on the floor, not on a table, with the puppy free to explore, with the puppy with treats, with the yoga mat, everything to, use quiet, gentle voices, involve the pet parents, the bond between that little girl and her puppy. It was the cutest thing to watch. And it's like really a pleasure to have an experience like that versus trying to do something the pet doesn't want, restraining them. Those are things that, we used to learn back in the day. Yeah. And we learn as veterinarians. I'm really thankful to be part of this amazing profession. We learn through mistakes that we've made, we progress, and we react. And, the fear-free training is not difficult. And if you mentioned for your team, if they don't offer, a complete certification for all your trainers, that would be something that you could spearhead too.
Yeah.
And I'm sure the people at Fear Free would be able to help you with that.
Yeah, I'm definitely going to contact them. So some of the little things, like you said, food for me, number one thing, if, you know, I go to a vet and they don't have Cheese Whiz or something, I think you even had that in the video. Right. So what are some of the kind of some treats that you'll have there?
Yeah. So some of the
dogs?
tips I say is, speaking of food, you know, that's the way to everyone's heart. Bring them hungry, you know, when they come to the vet, so that they're going to be more interested in whatever you're offering them. And also bring their favorite treats that they like, because not every dog's the same, and not every dog's going to tolerate the same kind of treats. Sometimes chicken will cause them to have a problem, or beef, or whatever it is. So you know your puppy better than anybody else. Make them as happy as they are at the vet as they are at home. So bring those things with you. You know, don't feed them breakfast that morning. We offer different varieties of things to see what they like. We attempt to offer them cheese. If they don't like it, we try pill pockets. If they don't like that, we try other treats. So every dog's a little bit different, but involving, you know, the pet parents as much as possible, involving their favorite toys, you know, keeping their handling to a minimal, so that they get to explore and essentially first ignore, you know, the puppy, not just this first thing, go up to the puppy and start checking it out. Allow it to acclimate. So just like you do with puppies, when you observe them, trainers have a knack for this. You know, it's in your DNA to see, okay, well, this puppy's trying to tell me this or that. And you make a living interpreting how they are and how they respond. So I think that's what puts you in a unique perspective. So we, as vets, aren't trainers, and we're actually, unfortunately, not the greatest at it. I'm guilty. My own puppies have, you know, their own issues. And I always tell people, well, I recommend a good trainer, but don't ask me to be your dog's trainer. But I give them tips, of course.
Yeah.
Fear Free Happy Homes is great for pet parents that are looking to do things. I don't know if you've seen that website. Yes.
I have not.
All kinds of nice tips for pet parents for their Fear
Free Happy Homes.
That's right. Yeah.
Okay.
And so, like you said, Fear Free has a number of different resources. So if you're looking for a Fear Free trainer, you can go on the Fear Free accredited tool locator. So you can find a Fear Free vet or find a Fear Free trainer. You know, there's a lot of different people that love pets that do different things that want to be involved in the movement. And I'm really happy that I got involved, because it's made a big difference. You know, some dogs that are so nervous, they come to us. A vet has never done an oral exam on them before, because when they're approached, they show their teeth, and then the vet doesn't want to start continuing to do things. So there's different things you can do to make that pet more comfortable, so you can do your oral exam that don't involve drugs. You know, there's an example. I don't know if you've ever seen the air muzzle, the little globe that goes around them.
No.
So it's an unbelievable thing. It basically looks like they're wearing a helmet.
It's called an air muzzle?
Air muzzle, okay. Right? It's for smaller dogs and cats. It works great for cats. So it's a little helmet that goes around most of the sides of their face, and it has a hole in the center. So they can see you or their pet parent, but they don't see people approaching them from the side. I don't know if you ever watch in the big cities where those horses have the blinders on them, keeps them calm. And it makes a big difference, you know, and that allows them to breathe. They can open their mouth. You don't have to close their mouth. Yep. Right. Offer them on a tongue depressor, their treats, cheese, peanut butter, whatever they like. And it keeps them a lot calmer. Not every dog does it work for, and every cat, but there's certain little things that we learn over the years that just make it a better experience.
I'll have to look that up. You know, it's like, I don't think people realize, or the people do realize that it's happened to their dog. Like, you get one dog that you have to hold down for a nail trim or something like that. And I'll just get it real quick, you know. That dog most of the time is ruined for life. Now I'll talk to owners and they say, I have to fully sedate my dog. And I'm pro meds, like the dog, you know, some dogs do need are so worked up that they do need the medication to kind of come back. But I think there's so many things we can do before it even got to that point.
Right.
Of the medication. Now you've kind of, this dog has these bad experience. Of course, they're not going to let you touch their paw. So,
sure. And then they have a trigger of going into the vet room, the exam room. So I've seen dogs like that, and we actually go to the outside of the hospital, and we're outside by the parking lot.
God, this is amazing.
And
this is why.
they're in the little bench outside. They see the cars go by. They can sniff this fresh air, and we'll get a blood sample from them while they're in the bench outside, instead of having to bring them into what triggered them in the first place, which was the lobby and the exam room.
Guys, did you hear that? Did you hear that? He takes the dogs outside so that he's smelling. He's doing. I mean, that's like amazing. That's why I think it's so important for that Fear Free. You're actually like, I'm sure other vets do it, but you're the first one that I heard that actually does that. So I usually tell, it's kind of like a hospital. I mean, I don't know about you. Everybody knows, I feel like, the smell of a hospital, right? When you walk in, you have that smell.
Of course.
I feel like it's the same for the dog. So even though you might still do this, they might get triggered when you go in. I usually tell my clients, bring a Kong, bring a licky mat, don't go inside, call them, tell them you're there. When the room is ready, so you're not in the lobby with sick dogs, sick cats, just making it uneasy. At least have them, like we just spoke about, on the ride there, have something, and when the room's ready, go in. But I didn't even think about it. I always tell clients that, okay, well, what happens we do all that, and you go into the room, and it's already a trigger for them because they already know this room. So now what?
Yeah, exactly. So that's a part of this process, is to learn that and try to identify it beforehand. And if I walk into the exam room and I can see that dog is, apprehensive, that dog is anxious, doesn't want to be touched, you'll be surprised at how quickly the whole situation changes. We say, you know what? Dog doesn't want to be in this room. Let's go outside for a minute and see how the dog does with the pet parent nearby. And it a lot of times makes a big difference. Just the location, the level of anxiety, the fear and stress just, starts to settle down.
Mm-hmm. So what do you do? It's your first time meeting a dog. You try everything, and they are very uncomfortable. And when we say fear-free too, I know this got a bad rap from like certain trainers years back, that they're like, not that there's no such thing, but there's always some kind of fear. It like, to a point, like you might not have completely the dog that's like 0%. They're not feared at all, but it's about making you, it's like a doctor having bedside manner when you're getting a procedure. Like, you're going to be fearful, but it's everything else that happened there. Like, even when I had a baby, like if the nurses were terrible and they just like, it would just give such an icky taste. So I think it's important to know, like, it's about keeping the pet as fear-free and comfortable as we can. But say my pet is totally shut down. We tried everything. They're not eating. You try outside, everything. What would be some next steps you may suggest for those extreme cases?
So there are a lot of pre-meds that can be given by the pet parent at home that can help to reduce their fear and anxiety and stress before they come in. There is a list of different medications that can be used for different situations, short-term or long-term. There are things that can be done before going back to the vet. If the pet is that anxious, having those meds started for a few weeks before they come back in to see how they respond to it is appropriate, because you want that pet to have less of a stressful situation when they come back in. So there are veterinarians who are experts in behavior, as you know, that can also be involved nowadays. Their behaviorists can do virtual consultations. They can do, prescriptions that way. Figure out what the triggers are. Try to identify, what in that pet's history has led to this, and what can we do to try to make that better. So it's all about just trying to recognize what is causing and creating these issues.
Yeah.
And I tell pet parents a lot, like, their body language and their nervousness is going to be directly, transmitted to their pets. So when these pet parents come in and they're so anxious, I said, listen, they are anxious, and the more you can be, calm, and the more you can be supportive and, whisper to them, tell them what they like, give them what they like, the more they're going to respond to just, okay, well, I don't have to be that worried because my mom or dad is not that worried. So it's all about how we interact. And, for example, like doing a cat exam, you don't start in their face. You go from tail to head. You don't go right at them to do their exam. You let them have a cat tree in the room. You let them have pheromones in the room. You let them explore. You don't force them out of the carrier. You open the carrier, you offer some treats, you let them explore. So you don't scruff them. There's a lot of things that we did in the past that we thought were the appropriate things to do, and they probably were for that time because we didn't have other options.
Yeah. And I think we sometimes want to rush the process. Like same with the groomer. If your dog's afraid of the groomer, your dog does not have to get groomed today, right? We can like, if your dog is that terrified, let's like take a step back. So it's just same as you said, like get the pre-meds, try it for a couple weeks, see how they do. There's also things that I recommend to people, well, to help the fear-free process. So I also say, not at a fear-free veterinarian office, but in every group class I teach, especially puppy class, I talk about muzzle training your dog with like a basket muzzle. And everyone looks at me like I'm nuts. I'm never going to need a muzzle. And I usually say, I promise you, it might be in 10 years, but your dog will at some point need a muzzle. And what's going to happen is if your dog is something, whatever is wrong at the vet's office, most vets, not your office, will put on those tight little muzzles that the dog can't eat or drink. And then they're causing that negative association. Whereas I muzzle train all my dogs, ear infection. I brought my own muzzle. I always have it just in case. There was a male vet tech. There was no way this male vet tech was coming in. They changed out the tech, but they were going to have to muzzle him because he would have 1,000% bitten. We got him to eat. We got him comfortable with his own muzzle. So I think it's just like also thinking ahead, it's, I tell people a muzzle is like riding a bike. There's the whole muzzle up project. If you teach a dog correctly, they love their muzzle. So I don't know how you feel about that, but I try and be proactive in certain things like that, hey, you don't ever have to use it. But if your dog has something happen, the last time they remember that, they were eating out of it, they were getting peanut butter out of it. So I think it's things like that too, to like help with your dog's fear, because some veterinarians in the moment, the process might be rushed instead of just like taking your time. I think it's super important that people look for a fear-free veterinarian. I didn't know that it's changed so much in the schools, so like veterinarian school. So that is like huge, because all my veterinarian friends have been vets 20, 30, 40 years, and there was none of that in there. So that the fact that you guys have that now is like amazing. What would be some places that pet parents can go to besides, like, obviously they can go to Fear Free, right? The website, is it Fear Free?
Yeah, fearfreepets.com.
Fearfreepets.com to look for resources. What other places can people go? Because listen, your dog's going to have to go to the vet. So even if you do your shots once a year and your dog is healthy, like unfortunately accidents happen and things happen. So we want to make sure that we're lining ourselves up with the veterinarian. What other resources would you suggest that they can go to kind of learn more about what to do?
There are a lot of websites that you can go to, and now it's all about keywords and searching. Everything from fear-free nail trims to fear-free blood draws, or any of those types of things. Like we put a lot of our videos of certain things we've done on YouTube for that reason. So I think the more you can learn about the fear-free process, the more you can learn about what you can do in your home to help minimize fear, anxiety, and stress. And like what you mentioned about the basket muzzle is amazing. Some of these pets that are anxious, they respond to the basket muzzle very well because they can still open their mouth, they can still get treats. They learn that it's associated with something positive instead of something negative. And so we wish we had more pets that have been to you that were trained, to help minimize their fears. And as long as you make something a positive experience, even in the past, if it had a negative connotation, you're still doing better and you're still trying to improve. Yep. So there's no perfect recipe. I think the more people educate themselves about the fact that there are veterinarians all over, there are thousands of vets that are Fear Free certified. Good. And there are many people that are trying to make it a better place. And we can all work together. There's no right or wrong recipe. It's just trial by error, and you see every pet responds differently. When a pet comes to us, we have a questionnaire for the pet parent that's pretty extensive. When you go to, something simple like the dentist, you have to sign a bunch of forms. So now we have a form that shows all the trigger points. My pet doesn't like to be touched by the tail, or my pet doesn't like its temperature taken, or my pet doesn't like to go up on the exam table. Yada, yada, yada. So we got to learn to do better, and we are doing better. And by people like you getting involved early in the socialization, I saw one of your recommendations about getting the puppies socialized very early. I agree with you 100%. The problem is
that's another podcast, guys. We're going to do just on socialization.
Exactly. If you don't do that early on, that's a critical period in their brain where they learn that, it's okay to have strangers. It's okay to have new dogs around or, different things. And just like with a baby, if they're not exposed to those things, they're going to be freaked out when they are.
Mm-hmm. I have to say, I love that this is one of the things that drew me to you in your office and educating people. So, I mean, this is amazing. We have to do more podcasts because there's so much other things to go over. I would say I did not know about the home. Tell me what that was called again that people can look for.
Fear Free Happy Homes.
Fear Free Happy Homes. I'm going today to go on that. I'm also going to see if I can get all of my staff certified under Fear Free. I am, but I'm not the only, everyone's fear free, but I'm not the only one that I think it's important. You learn so many things in these like videos and tips and tricks that you see on the certification. But I would also say to follow, where is the best way to follow? Because Dr. Mann's videos are amazing. He also does a laser procedure for Frenchies and breathing. So check those out too. We did a podcast on that before, but where can people look? Because I thought the post you just made with the little girl was like so adorable because, this little puppy and her was so adorable. But it just shows you what you should be looking for in a veterinarian, like what your experience should look like as opposed to kind of more robotic. And I do think there's a lot more, like you said, thousands of people. I know him. Some friends that just come out of veterinarian school, they look for a fear-free hospital to work in. So I think that's huge. But right. where can people, the best way for people to find you?
So on social media, Boca Midtown Vet, either on Instagram or TikTok or Facebook, but also on my webpage, Boca Midtown Animal Hospital, which is bocamidtownvet.com. I have a blog page and I put them in separate categories. So I'll have a whole page just for Fear Free. So all the videos, mostly videos I do of what we're doing to make it a better experience. And then I also have some articles on Fear Free there. I help to produce content for the DVM 360 magazine, which helps to also educate veterinarians. And so we have so much content out there. It's not like it was before where you can't find the stuff. So it's just a matter of, taking some time when you have a few minutes off to read about it and learn about it, because it will make such a difference, especially if your pet gets anxious going to the vet. And that's one of the reasons we are so dedicated to it, is because we want that experience to be good. We want these pets to go to the vet. Otherwise, they don't get their checkups.
Yeah. And I don't know if anyone, has children, but if you know what it is to have to take your child to the doctor or a haircut and they do not like it, it is like traumatic for everybody involved. So I think this is a way that we can, before we just take our dog to the vet, I never brought food. I didn't bring all this stuff. We just muscled through it and, came out. So now this is like a huge thing. It's been around for quite a few years too. So definitely check out Fear Free. Definitely check out Dr. Mann. Again, Boca Midtown. It's Midtown, Midtowne.
That's right. The old town spelling.
Midtown. It's right. Different spelling. Check out all of his social media. Thank you so much for coming. Again, you can listen to Barks to Basics anywhere we're a podcast, and also our YouTube at Dynamite Dog Training, Audible, Spotify, Apple Music, iHeartRadio. I was just on their show and it is on there too. So Barks to Basic. Thank you again. We'll see you next time.